Let's talk about how widespread ED is, because we've heard about it on the news, we see it in ads, but really how widespread and serious is it?
Statistics indicate that by the time they're in their 50s, about half of all men experience some ED issues, and the numbers rise with age up to about 70 or 80%.
Wow, so it really affects a lot of men, and it's something like we talked about before that can really take a toll on your self-confidence, on your personal life. So there's other ways to treat it too, but we're talking specifically about acoustic wave therapy, which is something that some men and their families may never have heard of. What is that?
It is something that a lot of people haven't heard of, and they're curious about. What is acoustic wave therapy? It's really kind of a revolutionary technology. It's the only thing on the market that deals with the root cause of ED as opposed to just treating symptoms. The way it works is it breaks up the blockages in the blood vessels and treats the root cause of ED, which is poor blood flow, basically.
Right, and all other treatments, I mean, they're just sort of putting a Band-Aid on the problem, right? Say like medicine, for example. Talk about how those, their effectiveness versus, say, something like acoustic wave therapy.
Sure. The popular ED drugs, Viagra, Cialis, and whatnot, deal with ED by dilating the blood vessels in order to deliver more blood flow. That's not a bad thing, because that is the cause of ED is lack of blood flow. However, what a patient needs to consider is that there are side effects to the popular ED drugs, to the extent that only about half the guys that need that kind of help can take those drugs, either because of side effects or because of interactions with other medications that they're taking, and they do lose effectiveness over time.
And testosterone therapy, I know, has been used in conjunction with acoustic wave therapy, right?
It has. There's a common misperception about testosterone, that low testosterone causes ED. That's actually not true. Testosterone has to do more with libido, and low libido can affect ED, but it's not the cause of ED. So if a guy has low testosterone levels, that's a separate issue that we need to address, but all the testosterone in the world is not going to fix an ED problem.
Right. It's about, taking care of sort of the whole picture, right? If there is a testosterone problem, then you guys can help solve that as well. And so, this is something that can be nerve-wracking for people to go into an office like this, discuss these issues with professionals. What can a guy expect when they visit your office?
Well, there's a stigma associated with ED. People don't like to talk about it, and so consequently we try to make our patients feel very comfortable. We have an all-male staff. We're not like a general doctor's office. All we do is treat ED. That's what we do all day, every day. We create a comfortable environment for men to come in and get the help that they need with their ED. We're professionals, we're experts at what we do, and we strive to make our patients feel comfortable.
You're their best friend. I mean, you're going to help them regain this part of their life that they might be missing, that will really sort of bring back a lot of that confidence that we've been talking about. And so it's a series of in-office treatments. About how long does it take, how many treatments, etc.?
Sure. The in-office treatments last 20 to 30 minutes, a couple times a week. Men start to experience benefits from the treatment as early as a few treatments, and sometimes with more profound cases of ED, it might take months. The good news is we can fix the problem.
Right. That's music to a lot of people's ears, I'm sure, struggling through it. So how does somebody know that this is right for them? Do they need, say, a doctor referral?
No referral needed. Okay. The process starts with a visit to our office, an exam and consultation with our in-house physician, who will do a physical exam and a health history and determine if this is the right treatment for a patient, and then make recommendations going forward. Yeah,
excellent. And so, in 30 seconds or so, if someone has been on the fence about addressing this issue, what would you tell them to sort of take control, take notice, and come in and see you guys now and start the process?
Get educated. That's the big thing. There is a lot of material on our website, links to medical studies from around the world that talk about the effectiveness of acoustic wave therapy. And that would be my advice. Get educated about it, and give us a call. We're happy to talk about it.
It's great advice, and there's a great offer too for the initial consultation, which I'll give them here today. But Bill Jeffries, as always, thanks for being here.
Thank you for having me.
All right, guys, right now, like I said, there's a special offer. You can get $100 off your initial consultation if you mention the Morning Blend. If you want more information, visit flagstonemedical.com or call 520-600-4405.